good morning, good evening, whenever you're watching this. My name is Demetrios and I am making this video in regards to a client of mine. Now, as an exercise scientist, my role is to use the most current and reliable research in relation to exercise in order to design and deliver interventions that are specific to my clients and their goals. Now, these goals can include the improvement of fitness, performance, and or the prevention of injuries as per the accredited exercise scientist scope of practice. Now, this video will discuss the changes that occurred over a 5-week intervention program designed for a client of mine. Now, to begin, I would like to provide a concise background of my client's information along with what was discussed to be his end goal during the initial client intake. Along with this, I will provide information on the outcome of objective measures and assessments as well as subjective assessment results that were taken. Overall, the purpose of this video is to provide you, the accredited exercise physiologist, the relevant information about my client, how he performed and improved during the intervention program, and if there were any hurdles. Now, my client's name is Ryan Edwards. He is a 22-year-old male who plays AFL on a regular basis at a relatively high level. We will briefly go over his objective measurement results. Now, as you can see in the table, Ryan underwent various tests including heart rate, blood pressure, height, weight, BMI, waist circumference, and waist to hip ratio. In all of these measurements, Ryan is considered to be healthy when compared to normative data and healthy range, which can be found in the ESSA student handbook. Now, during the subjective assessment, my client's goals for the intervention were to increase overall fitness for AFL, but more specifically to increase muscular strength. Now, during the initial interview, it was also found that Ryan, my client, generally had a strong social support network around him, which may assist in consistency over the next 5 weeks. Additionally, I found that he had an excellent familiarity with working out in the gym, which is very, very beneficial as exercises could be executed easily and thus promote a more effective and smoother intervention program. However, it was discovered that the client did have some minor barriers to exercise that came in the form of tight schedules because of AFL games and training days, as well as injuries. Now, these injuries included both an ACL injury on the right knee and a shoulder injury. Both were nearly completely healed, however, but intense exercise sometimes irritated them. Therefore, the intervention I was to make required intensities that would build strength, while on the other hand, it needed to be supplemented with specific exercises to the knee and shoulder at an intensity that would promote stability rather than merely overall strength. Now, moving on to the objective assessments, Ryan underwent various tests that included maximum push-ups, squat test, plank, trunk flexibility, and lastly the YMCA cycle ergometer test, as you can see in the table. Now, these tests were specifically chosen as they were most relevant in my eyes to his goals and generally increasing muscular strength. Now, all the results achieved were either within an average healthy range or excellent, as was in the case with the 4-rep max squats. The only assessment in which Ryan scored poorly was the YMCA cycle ergometer test, which measures VO2 max. Or to be more accurate, VO2 max could be extrapolated from that test. Now, moving on to intervention design. When thinking about designing this intervention program, there was obviously muscle groups that I favored to target because it would align more with his goals. Now, this would include, as you can see in the table, chest, quads, hamstrings, shoulders, and back. Now I'll go through with you what exercise we use for those muscle groups and the reasons why. For the chest, we usually use bench press and incline bench. No specific reason, just because these ones target the muscle. For the quads, we use split squats and leg extensions, and this is because single leg movements have been shown to improve joint stability, which is very relevant to Ryan because of his ACL injury or previous ACL injury. Hamstrings, we use Romanian deadlifts and hamstring curls. Similarly to the reasoning for single leg squats, improving hamstring strength is not merely to improve it on its own in an isolated manner, but rather because of its large role in protecting the ACL. For the shoulder, we used lateral raises and banded external rotations. This is because shoulder external rotation exercises have been shown to increase joint stability by strengthening rotator cuff muscles. For the back, we use dumbbell rows and lat pull downs. Similar to the chest, no specific reason, but just because these exercises, of course, target that muscle group. Now, for progression, all exercises were completed with 1 to 2 RIR. This is because 1 to 2 reps in reserve is found to be equivalent to 8 to 9 RPE, which is known to be an ideal intensity range for strength training. To progress each week, load was increased so that the same RIR was maintained. Now, let's talk about home exercises. For Ryan, because of his tightly packed schedule, there was no prescribed home exercises. This is to avoid potential overuse injuries that may have occurred due to an already crowded schedule. In terms of exercise modifications, sometimes Ryan had a sore back, which seemed to be caused by high frequency of rotational forces during AFL. As a result, mobility sometimes was an issue where some exercises were harder to execute. Now, exercises were then modified to accommodate this new barrier. An example of this is replacing a bench press with a seated bench press, as it is easier for the client to get into the starting position. Behavioral techniques. Now, a basic technique that I utilized during training sessions was feedback on performance. Now, this involves both short-term, for example, praising technique, and long-term feedback, for example, acknowledging increased strength over time. Now, this is because this technique has been shown to promote consistency and a positive morale. Now, intervention results are very important. As you can see in the table below, there is the same test that we did in the objective assessments. And next to it, you can see the pre-intervention results and post-intervention results and what changes there are. So for maximum push-ups, that's improved by 2. Squat test has also improved. Planks have improved. Trunk flexibility, unfortunately, has decreased, but not by much. So it may not be a significant change. And on the YMCA cycloergometer, there is no difference. Now, overall, I would say these are good results in terms of what our program was designed to do, because neither flexibility nor cardiorespiratory endurance was targeted. So yeah, positive results. Now, lastly, onto professional reflection. This is a tricky one because it wasn't stationary throughout the weeks. It changed over time. So what I found difficult in the first few weeks was timing. Sometimes we didn't get enough time to finish all the exercises that we needed to do, which of course is not a good thing because you won't get stronger in those muscle groups that we missed. And also increased possibility of increased risk of injury because of reduced amount of time for warm-up or reduced amount of time for cool-downs. Now, another point is in my relationship with the client. Over the weeks, it seemed to me that it became sometimes too friendly, in which sometimes maybe our execution of exercises may not have been ideal or at the right intensity that we needed it to be, which again can halter progress. Another point is the use of cues. I didn't use this as much in the beginning, although I did use it a little bit more near the end. And lastly, telehealth sessions. There was a week where we had to communicate through our devices. It was ill-prepared because we didn't realize how noisy the gym would be. So we know now that we ought to use headphones or something with a louder speaker.